We had the pleasure of visiting Kids Physio in Vancouver BC and talking to them about how they use AFX. From the beginning, Kids Physio has focused on doing one thing: providing specialized, one-on-one physiotherapy services to children in Vancouver and the Lower Mainland in a fun environment. And from the moment you walk through the door, you are immediately impressed by what an incredible team they have assembled and a special facility they have created.
My name is Laura Patrick, and I'm the owner at Kids Physiotherapy in Vancouver. I'm a registered physiotherapist, and I primarily treat and have special interest in working with children with physical disabilities and athletic injuries.
I'm Kate Norrish, and I'm a physiotherapist at Kids Physiotherapy, and I provide physiotherapy treatment to children typically from the age of 3 weeks old to about 18, 19 years of age.
First of all, we love the AFX, and primarily for this population. It's something that we have been looking for a long time. The AFX is also really useful for children who have a developmental delay in their gross motor skills. We see children with low muscle tone, and the AFX is just really useful for helping to develop the strength in and around the ankle and foot. And it's just a relatively fun piece of equipment to use, especially when we let the children know that some of those high-level athletes are also using the product.
Here at Kids Physio, we use the AFX, typically with children who have a variety of different diagnoses, including cerebral palsy, kids with global developmental delay and lower tone. We use it to work on their intrinsic foot muscles. We also use it a lot for children with athletic injuries, so kids that come in with ankle sprains or children with Sever's disease, and any child basically that comes through our doors that needs a little bit of foot strengthening.
Kids with visual impairment, it is sometimes a challenge when you're trying to explain an exercise. So having something that is a little bit more stable around their foot, so the foot plate that the AFX has gives that sense of sort of proprioception right from the get-go, so they understand where their foot is, and then just to feel that resistance in the way that the AFX works is really beneficial for children who are visually impaired.
In different resistance bands before, and I find that it always slips off the kids' feet. I really like with the AFX that it stays on there snugly no matter what exercise we're doing, and there's a lot of variety in what we can do with it. The other thing I really like about it is the fact that we not only get the plantar flexion, dorsiflexion, inversion, eversion, but we also can get those intrinsic muscles by the foot being able to curl, which is great.
But the AFX has really filled that gap for us where it doesn't slip, it doesn't fall off. It's really simple for children to understand the concept. Functionally, to work on plantar flexion and dorsiflexion, we often get children to walk around on their tippy toes or walk on their heels. The AFX is just a great complement to some of those exercises because it really allows us to provide the resistance and the repetition to help support that very functional activity as a child to be able to walk on your tiptoes. At Kids Physio, we often treat children with idiopathic toe walking, so that basically means that they tend to walk on their tippy toes. One of the areas of strength that needs to improve is the ankle dorsiflexors, and the AFX is the perfect piece of equipment to use to help get kids off their toes and over-strengthen their dorsiflexors so that helps to prevent that toe walking.